To improve access to highly specialized care and to further its commitment to patients suffering from spinal disorders, St. Vincent Medical Center has opened the St. Vincent Spine Institute, a multi-specialty spine care clinic that is part of a one-stop hospital-based orthopedics program dedicated to providing world-class clinical and minimally invasive interventional care to patients.
We've moved more into the industrial ages and industrialized society. There's less emphasis on activity, and spine, like any other moving part in our body, needs to be active because of the joints, because of the lubrication of those joints. So if you lead a sedentary lifestyle, the joints and the spine are the first areas that are going to show deterioration. The next level will be the disc. Once the joints are getting more stressed than normal, then the disc ends up being a problem, and they can happen simultaneously or they can happen in sequence. The more serious type of back pain is the one that doesn't go away with what we call conservative measures. It's the type of pain that will not go away, let's say, through some massage therapy, some anti-inflammatory, and it starts to debilitate the person. It starts to interfere with their lifestyle. They can't even do some initially sports activities, and then they can have difficulty with walking. Then they start having leg and sensation problems and pain going down the leg. So it's a sequence of things that happen, and since it's progressive, patients tend not to be so alarmed about it. It can happen that suddenly patients wake up with shooting pain, for example, in their legs, but majority of the time it's a progressive problem, and when we get to the point of weakness in the leg is when they seek help. But the point is they should come see a physician or their own doctor prior to developing frank weakness in the leg. People become very anxious once they have back pain, or any pain in particular, but back pain, because their lifestyle and their activities become so limited, and all of a sudden, from being highly active and going out and doing sports, they become bedridden. And the good news is that the majority of those patients do improve without need of spine surgery. It's the recurrent back pain. It's the pain that shoots down into the leg, the pain that causes severe numbness or weakness in the leg that needs to be attended to and further diagnosed. But majority of time when you have difficulty rotating your neck side to side, even simple driving becomes a chore, you have difficulty looking up to do your work, those are the times that patients become more concerned about the pain, and that's when they start seeking help, and that's when we get involved. Over the last decade, there has been so many new and more effective ways of dealing with the same problem that we've been tackling for all humanity, which is back pain and sciatica. And the newer techniques, the emphasis is to preserve the anatomy as much as possible, to preserve the musculature that surround and support the spine as much as possible, because after surgery is done, we want the patient to go back to the same, if not better, level of activity. And the soft tissue that invests and controls and supports the spine is what ends up being the working part of the spine in the future. So a lot of the emphasis is not given to preserve the muscle and what's so-called muscle sparing or minimally invasive type approaches, and that's what I do. So the goal of the doctors at the St. Vincent Spine Institute is to provide the best care in terms of spinal care for all patients and provide the full spectrum of care. It's not necessarily surgical care, it's any type of care that would provide the goal of getting the patient better. My passion is tennis, so I try to play at least twice a week, and then in between I try to do what we call isometric exercises. These are types of exercises that don't put too much strain on the joint, but at the same time try to keep your muscles in good shape, and that's my secret, I guess. Pain is not normal, at any age. And I've had patients that come in and say, "Doc, well, I'm in my 50s and 60s, so pain is expected." And I tell them, no, that's not the case. I have had patients in their 80s and 90s that come in and they're still highly active and they have minimal, if any, back pain. So pain by itself is a sign of, quote unquote, something is wrong and your body is sounding the alarm. So it's important to get the needed care to find out if it's a simple muscle strain that can be helped, or is it coming from something more serious that needs to be looked into. Being in bed, or quote unquote being bedridden because of pain, can have a secondary detrimental effect on the muscles, and the muscles can get weak. So the new idea is that minimize the amount of time spent in bed, try to become more active, and try to get the right type of care. It could be a simple muscle strain that will be helped by muscle treatment or reconditioning and anti-inflammatories and muscle relaxants, or it could be a sciatica type pain that, if it doesn't go away within the first 1 or 2 weeks, needs to be investigated more.
For more information on the St. Vincent Spine Institute, please visit www.stvincentspine.com or call 213-484-7310.